ಇದು ಶೇರ್ ಅಂತ
ಅಲ್ಲ
ಅಲ್ಲ ಒಂದು ಶೇರ್
ಶೇರ್ ಇಲ್ಲಿ ಶೇರ್ ಉಂಟಲ್ಲ
ವಾಟ್ಸಪ್ಪಿಗೆ ಹಾಕ್ತೀರಾ?
ಓಕೆ ಹಾಂ
ವಾಟ್ಸಪ್ ಎಲ್ಲ ಹಾಕು ಇಲ್ಲಿ ಹಾಕೋದಾ
ಅದಲ್ಲ
ಇದು ಬೇಡ
ಇಲ್ಲ ಬೇಡ
ಇದಕ್ಕೆ ಹಾಕಿ ನನಗೆ ಹಾಕಿ ನಾನು ಸೆಂಡ್ ಮಾಡ್ತೀನಿ.
ನೋಡಿ ಒಂದ್ಸಲ ನೋಡಿ ಚೆಕ್ ಮಾಡಿ.
ಈಗ ಮಿನಿಮೈಸ್ ಅಲ್ಲ ಮಿನಿಮೈಸ್ ಮಾಡಿ ಹಾಂ ಇದು ಓಪನ್
ಅದು ಇದಾ
ಡೆಸ್ಕ್ಟಾಪ್ ಈಗ ಅಲ್ಲ ವೆಬಿನಾರ್
ಲೈವಲ್ಲಿ ಲ್ಯಾಪ್ಟಾಪ್ ಬಂದಿದೆ.
ಹಾಂ ಅದೇ ವೆಬಿನಾರ್
ಓಪನ್ ಮಾಡಿ.
ಸ್ವಲ್ಪ ಸೆಕೆಂಡ್ ಬರ್ತದೆ ಅಲ್ಲಿ ಸ್ಟೀಮ್ ಸ್ಟಾರ್ಟ್ ಕೊಟ್ಟಿದ್ದೆ
ಆಗಿದೆ ತೊಂದರೆ ಇಲ್ಲ.
ಇದು
ಶೇರ್ ಮಾಡಿ.
ಇದಕ್ಕೆ
ಲೈನ್ ಆಗಿದೆ. ಹಾಂ
ಇದು ಬರ್ತಾ ಉಂಟಾ ಇದು ಬರ್ತಿಲ್ಲ
ಇದು ಸ್ಕ್ರೀನಿಂಗ್ ಸ್ಕ್ರೀನ್
ಸ್ಕ್ರೀನಿಂಗ್ ಬರ್ತದೆ
Registration has been closed yesterday itself. We have got lot number of registration. We cannot connect them in Google Meet. That's the problem. Have you registered? It's it has been that's been closed.
ಇದು ಬರ್ತದೆ
It's already started. Sir. Already it's been started.
ಯೂಟ್ಯೂಬ್
ಈಗ ಹಾಕಿಲ್ಲ It's
ಅದು ಸ್ಟ್ರೀಮ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಬಟ್ ಡಿಸ್ಪ್ಲೇ ಬರ್ತಾ ಇಲ್ಲ ನನಗೆ. ನಾನು ಜಾಯ್ನ್ ಆಗಿದ್ದೇನೆ.
ಒಂದು ನಿಮಿಷ ಇಲ್ಲಿ ಮಿನಿಮೈಸ್ ಮಾಡಿ ಇದು ಓ ಪಿ ಎಸ್ ಸಿ
OBS-ಅಲ್ಲಿ ನಮಗೆ ಡೌಟ್
ಇಲ್ಲಿ ಕೊಡು ಪುನಃ ಸತಿ ಕೊಡು
ಡಿಸ್ಪ್ಲೇ ಕ್ಯಾಪ್ಚರ್
ಹಾಂ
ಇಲ್ಲಿ ಓಕೆ
ಹಾಂ
ಸೆಲೆಕ್ಟ್
ಹಾಂ ಓಕೆ ಸರ್
ಓಕೆ
ಈಗ ಮಿನಿಮೈಸ್ ಮಾಡಿ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆಯಾ
ಸ್ಟಾರ್ಟ್
ಸ್ಟಾರ್ಟ್ ಉಂಟಾ
ಸ್ಟಾರ್ಟ್
ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ ಮಿನಿಮೈಸ್ ಮಾಡಿ
ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ
ಅಲ್ಲ ಬರ ಯೂಟ್ಯೂಬ್ಗೆ
ಅಲ್ಲ ಅಲ್ಲಿ ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ ಏನಾದ್ರು ಕೊಡ್ಬೇಕು ನಾವು
ಅಲ್ಲ ಅಲ್ಲಿ ಬರ
ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ
ಅಲ್ಲ ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ ಬಿಡ್ತಿಲ್ಲ ಇಲ್ಲಿ
ಅಲ್ಲ ಯೂಟ್ಯೂಬ್ ಇಲ್ಲಿ ಈಗ ತಗೊಳ್ತಾರೆ
ಯೂಟ್ಯೂಬ್ ರಿಸೀವಿಂಗ್ ಎನಫ್ ಸ್ಪೇಸ್ ಇದು ರೆಕಾರ್ಡಿಂಗ್ ಇದಲ್ವಾ ಅಂತ ಇದೆಯಾ ಇನ್ನ ಸ್ಪೇಸ್ ಅಂತ ಬರ್ತಾ ಉಂಟು
ಬರೋದಿಲ್ಲ
ಯೂಟ್ಯೂಬ್ ಈಸ್ ನಾಟ್ ರಿಸೀವಿಂಗ್ ಇನಫ್ ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ ಇದು ಕೊಟ್ಟು ನೋಡಿದ್ರಾ?
ವರ್ಚುವಲ್ ಕ್ಯಾಮ್ರಾ ಬರೋದಿಲ್ಲ ಅದಕ್ಕೆ ಯಾಕಂದ್ರೆ ನಮಗೆ ಬೇರೆ ಕ್ಯಾಮ್ರಾ ಕನೆಕ್ಟ್ ಮಾಡಿಲ್ಲ
ಇದು
ಅದು ಬರ್ತಾ
ಇಲ್ಲಿ ಯಾಕೆ ಇದು ಬರ್ತಾ ಇದೆ? ನಂದು ಸ್ಕ್ರೀನ್ ಯಾಕೆ ಬರ್ತಾ ಇದೆ?
ನಿಮ್ದು ಸ್ಕ್ರೀನೇ ಬರ್ಬೇಕಲ್ಲ
ಅಲ್ಲ ಸ್ಕ್ರೀನ್ ಆಯಿತು. ದಿಸ್ ಈಸ್ ನಾಟ್ ಪ್ರೆಸೆಂಟಿಂಗ್.
ಅಲ್ಲ ಇದರಲ್ಲಿ ಈಗ
ಐ ಆಮ್ ಗೆಟಿಂಗ್ ಮೈ ಓನ್ ಸ್ಕ್ರೀನ್ ಓನ್ಲಿ.
ಅದನ್ನು ಲಿಂಕ್ ಮಾಡಿ
ಕ್ಯಾಪ್ಚರ್
ಫಸ್ಟ್ ಒಂದು ಹಾಕಿ ಇದನ್ನು ಮಾಡಿ
ಅಲ್ಲ ಆ್ಯಡ್ ಮಾಡಿಕೊಂಡು ಬೇರೆದೇನಾದರೂ ಹಾಕಿ ಬರ್ತದೆ ಗೂಗಲ್ ಮೀಟರ್ ಲಿಂಕು.
ಅಲ್ಲ ಇದನ್ನು ಇಲ್ಲಿ ಸ್ಟಾಪ್ ಕೊಡಿ ಮಿನಿಮೈಸ್ ಕೊಡಿ ಯೂಟ್ಯೂಬ್ಗೆ ಹೋಗಿ ಇಲ್ಲದೆ ಇದೆ
ನನಗೀಗ ಲಿಂಕ್ ಕಳಿಸಿ.
ಅದೇ ಲಿಂಕ್ ರಿಫ್ರೆಶ್ ಮಾಡಿ
ಸೇಮ್.
ಯೂಟ್ಯೂಬ್
ಹಾಂ ಈಗ ಬಂತು ಈಗ ಚೇಂಜ್ ಇಟ್ಟು
ಮಾಡಿದೆ ಚೇಂಜ್ ಮಾಡಿದೆ
ಬಟ್ ಇದು ಬಂತು.
ಅದು ಬರ್ತದೆ
ಮತ್ತೆ ಬರ್ತದೆ
ಹಾಂ ಥ್ಯಾಂಕ್ ಯು.
ರೆಕಾರ್ಡ್
ರೆಕಾರ್ಡಿಂಗ್ ಆಗಿ
ಕ್ಯಾಪ್ಚರ್ ಅಲ್ಲಿಗೆ ತಗೊಳ್ತಿರ್ತೀವಿ ರೆಕಾರ್ಡಿಂಗ್ ಮಾಡೋಣ
ಅದು ಎತ್ಕೊಂಡು
ಎರಡು ಇತ್ತಲ್ಲ ಸ್ಟಾರ್ಟ್ ಹೋಗ್ತಾ ಇತ್ತು ಅದು ಅದನ್ನು ತಗೊಳ್ತಿತ್ತು ಅದಕ್ಕೆಲ್ಲ ಡಿಲೀಟ್ ಮಾಡಿ
ಆಯ್ತಲ್ಲ. ಇಲ್ಲಿ ಯೂಟ್ಯೂಬ್ ಮಾಡ್ಕೊಂಡು ಈ ವಿಷಯ ಮಾಡ್ಬೋದು. ಇದು ಯೂಟ್ಯೂಬ್ ಓಪನ್ ಮಾಡಿ ಹಾಗೆ ಅಲ್ಲಿ ಸೆಟ್ಟಿಂಗ್ ಕೊಡಿ. ಅಲ್ಲೇ ಅಂದ್ರೆ ನಿಮಗೆ ಕ್ಲಿಕ್ ಬರ್ತದೆ.
ಅಲ್ಲ ಇದು ಪಿನ್ ಮಾಡಿ ದೊಡ್ಡದು ಮಾಡಿ ಅಲ್ಲ
ಆಮೇಲೆ ಪಿನ್ ಮಾಡ್ತಾರೆ.
ಅಲ್ಲ ಇಲ್ಲಿ ಪಿನ್ ಮಾಡಿ ಅಲ್ಲ ಇಲ್ಲಿ ಪಿನ್ ಮಾಡಿ
ದೊಡ್ಡದು ಮಾಡಿ.
ಅಲ್ಲ ಇಲ್ಲಿ ಪಿನ್ ಮಾಡಿ ನಿಮಗೆ ಯೂಟ್ಯೂಬಲ್ಲಿ ಪಿನ್ ಹಾಕ್ತದೆ
ಆಯ್ತು.
ಆಗ ಎಲ್ಲರಿಗೂ ಅದು ಯಾರು ಮಾತಾಡ್ತಾರೆ ಚೆಕ್ ಮಾಡ್ಕೊಳ್ಳಿ ಅಲ್ಲ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲ ಯೂಟ್ಯೂಬ್
ಈಗೆಂತ ನೀವು ಇದು ಮಾಡ್ತಿದ್ದೀರಾ ಶೇರ್ ಗೂಗಲ್ ಮೀಟಿಗೆ ಗೂಗಲ್ ಮೀಟ್ ಆಗ್ತಿದ್ದೀರಾ ಯೂಟ್ಯೂಬ್ ಮೀಟ್ ಆಗ್ತಿಲ್ಲ ಅದಕ್ಕೆ ಆಗ್ತಾ ಇರಲ್ಲ ಅಪ್ಡೇಟ್ ಆಗಿದೆ ಅಪ್ಡೇಟ್
ಇದು ಹೇಳಲ್ಲ ಮತ್ತೆ ಬರ್ತಾ ಉಂಟಾ ಸಾಫ್ಟ್ ಸೆಲ್ ಉಂಟಾ
ಯೂಟ್ಯೂಬ್ ಫುಲ್ ಸ್ಲೈಡ್ ಬಂದಿದೆ ನನ್ನ ಬರೋದು ನಾವು ಓಡಿಸ್ಕೊಂಡು ನಾವೀಗ ಮಾತಾಡ್ತಿರೋ ಅದೇ ಟೈಮಿಗೆ ಅದು ಹೊತ್ತು ಬಿಟ್ಟು ಬರ್ತೀವಿ ಲ್ಯಾಗ್
ಏನು ಅಂತ ನಮ್ಮ ಕನ್ಯೆ ಟೋಟಲ್ screen meeting days 6, enrolled 4, 2 free and failure, 1 fibroid, uterine fibroid, 2 subclinical hypothyroidism. ಅದೇ 15 months back 3.338 ಇರ್ತೀನಿ ಅದೇ ವಿತ್ 5.7 ಮೇಲೆ ಆಸ್ ಪರ್ ದ ಲ್ಯಾಬ್ ರೆಫರೆನ್ಸ್ ರೇಂಜಸ್ 4.5 is the upper limit ಅಂತ ಒಂದು ಥ್ಯಾಂಕ್ 3 ಮರಳಿ ಹಾಸ್ಟೆಲ್ ಹೋಗ್ತೀನಿ 3 ಜನ ಐಡೆಂಟಿಫೈ ಮಂದ ಟು ಫಿಟ್ ಇನ್ ಟು ದ ಕ್ರೈಟೀರಿಯಾ ಬಟ್ ದೇ ಆರ್ ವೇಟಿಂಗ್ ಫಾರ್ their parents to come and along with the parents they got to come visit the hospital. Join ಆಗ್ತದ ಜಾಯಿನ್ ಆಗಿದೆ ಮೇರಿ ಪದ್ಮ ಸರ್ ಆಯುರ್ವೇದಿಕ್ ಬಂದಿದೆ
It can lead to sloughing and blood stain discharge, leading to irregular vaginal bleeding. There are different secondary changes which are explained: cervical carcinoma through pap smear and endometrial sampling. Ultrasonography for small submucosal, it is better to go for transvaginal scan. If it is bigger, it is better to go for abdominal scan. Saline infusion to know whether it is a polyp or fibroid, it is one of the main technique. Color Doppler just to know whether the circulation, how the blood supply is there, whether it is a deeper or it is a superficial blood supply, to do the either it is hysteroscopic resection or laparoscopy. So this will help to know the exact cause and blood supply. MRI is a very good investigation in order to differentiate adenomyosis and fibroids. This will clearly give us the size, number and location of the fibroid, which is very important for diagnosis and counsel the patient. Hysteroscopy is very helpful. During hysteroscopy, you can see submucosal fibroids, and at the same time, even we can, with the resectoscope, you can directly remove. We have 2-3 cases where hysteroscopic resection was done. Then the patients were not having any menorrhagia, and their life quality of the life was good, and cycles were regular. HSG especially to see the flow of the dye, so that any corneal spillage, if the corneal is closed, then spillage cannot be seen. So sometimes obstructing fibroid may be there at the cornea. Laparoscopy, when the size of the uterus is less than 12 weeks, we can go for laparoscopy. Or else we can go for open hysterectomy. There is a FIGO classification depending on the site and location, which is not that important to know. Just to localize, they will be giving where exactly is the presence and location of the fibroid. How the modern people are managing. So usually they manage to reduce the symptoms of menorrhagia. If menorrhagia, they will correct the anemia before surgery, and they try to reduce the size of the fibroid. There are both hormonal, non-hormonal and surgical treatments which are available. So usually POSMF, the commonly wide medicines for excessive bleeding is tranexamic acid. So usually it will reduce the bleeding for menorrhagia. And aromatase inhibitors like aromatase, which are like letrozole kind of things, which will be helpful in reducing the size and reducing the bleeding. And prostaglandin synthetase inhibitors like aspirin, naproxen, indomethacin, these will reduce the prostaglandins and vasoconstriction, so there will be reduction of the pain. So all these are symptomatic treatments which can be given. There are some medications which are given for 3 months, like GnRH agonists and antagonists. They will be causing hypoestemic condition, hypoplasia of the uterus, along with the reduction of the size of the fibroid. But in long run, they will be causing hot flushes and even hirsutism. So they cannot be given for a longer time. And to reduce the bleeding, levonorgestrel, that is a type of progesterone, to block the progesterone receptors is given. So this will reduce the bleeding, and in long run, it can even reduce the size of the fibroids. Other things are like mifepristone. Usually, it is an anti-progesterone. It blocks the receptors. So it can be given for 3 months. So it also causes amenorrhea, and also in long-term use, it has even increased endometrial hyperplasia, making the woman prone for endometrial cancer. So there are many limitations for these drugs. Danazol is a commonly used drug in the present practice. So it immediately minimizes the loss, but the reduction of the volume of the fibroid will take a longer time. So polypectomy through the hysteroscopy can be done. Myomectomy, where the surgical enucleation of the myoma is done when the fertility is desired. So better to do myomectomy. Usually through laparoscopy it is done. So hysterectomy is done when the family is completed and the patient don't want to take any hormones. So if there is any prolapse of the uterus, better to go for vaginal hysterectomy, else abdominal hysterectomy. If the size of the uterus is less than 12 weeks, a laparoscopic hysterectomy can be done, else open hysterectomy is recommended. These are there are other minor methods like enucleation and embolization, taking out the endometrial ablation, and uterine artery is blocked so that there is no blood supply to the fibroid, and then there is reduction of the symptoms. These are all temporary methods. Coming to the Ayurveda perspective, which is the major topic which is given to me, even though there are many classics, many discussions are going on Arbuda and fibroid uterus. After going through the literature for Gulma, Granthi and Arbuda, there is no proper correlation or exact correlation cannot be made to uterine fibroids. Okay, there are many discussions which we have made we have made and we have learned through the literature and discussed with the teachers and elders. So after going through the literature, I felt that nor the Gulma nor the Granthis can be given a complete justification for the comparison of the uterine fibroid. I feel Garbhashaya Arbuda. So in there are other types also which we will be going through. So Garbhashaya Arbuda, what Shushruta has given is Gatar Pradeshe Kvachideva Doshaha Samurchita Mamsam Abhipradusham Vruttam Stiram Mandarujam Anantam Moolam. So Chiravruddhi Apakam Kurvamti Mamsopachayantu Shofam Tam Arbudam Shastra Vido Vidanti. So he says that anywhere in the body, but there was a discussion with even Shalya teachers where they say that Gatra Pradesha should be taken as superficial body only. You cannot take internal organs. But in other aspect, we can take anywhere in the body. There can be the vitiated doshas can reach the Mamsa Dhatu wherever the Sthana Samshaya is there. Then there is vitiation of the Mamsa Dhatu, and then they will be producing a circular Vruttam Stiram, that is circular, fixed, hard, Mandarujam, that is not painful, Mahantam. So they are big, and Analpamulam, they are very deep rooted because they are present in the pelvic region. Chiravruddhi, they take longer time to grow in size and they will not separate. So this is the one term which is very important to understand. Apakam. So whenever Shushruta is enumerating Granthi and Arbuda, he says to differentiate Granthi if it is not treated and if it is not getting separated even after application of certain medications, then you have to consider it as Arbuda. Okay, so Kurvanti Mamsopachayam, this muscular protuberance or that hyperplastic mamsa, so the tissue which has grown, which is causing shofa, basically there will be a swelling. So that Mamsopachaya shofa. So this is a major clinical feature where the muscular protuberance or the neoplasm or the Arbuda is there. So that can be considered as Arbuda. So which is a clear or closer relation to the fibroids. So Nidanas are given, you know that Shofa Samuthana is there in Ayurveda classics, which is very important in Shalya. So they have given same Nidanas, majorly same clinical features under Shofa Samuthana as Shota, Arbuda, Granthi, Apachi, Galaganda. So they all carry certain kinds of characteristic features, nidanas, and differentiation is very minimal. So for differentiation also there is a literature. To some extent we can go through that literature to identify what is Granthi and what is Arbuda. So he has given nidana like Shota nidana as same. So there are different nidanas enumerated by Sushruta. First one is Amaya. So whenever we see to this, we will come to an understanding that Amaya is general diseases like Jora. Post Jora, usually we will be having Agnimandya and the immune response is very less and the Dhatu Samyata will be very less. And the next, coming to the next Nidana, what he has given is Abhaktam, not taking proper food or timely food is not taken. Then the Rasadhatu which is produced will not be enough to give the strength to the body, or there can be even ama because of the mandagni or vishamagni. So he has even given krishanam abalanam, so emaciation due to the various reasons. So whenever there is an emaciation, there is vata vruddhi in the body. So they have given, Sushruta has clearly given all the three doshas will be vitiated by their own reasons and there is ama production. So here we can see how it goes. And next is Kshara Sevana. Kshara Sevana can be taken as usage of physical irritants can be taken, or orally if we are taking Kshara. Kshara is nothing but the which does more of Lekana, Vyavai, Vikashi and does Ojokshaya, Kafakshaya, that kind of drugs or food articles if you take. For example, you can take it as an Ajinomoto or tasting salt or preservatives, because all the packeted foods will be having one or the other preservatives which will be acting as chemical which will be irritant to our GIT tract. So those can be taken as Kshara Sevana, or sausages or even Chinese food which is very Tikshna Ushna can be taken as Kshara. So this kind of dietetic habits. Along with that, he has also mentioned Dadi Adi, curd like Abhishandi Ahara, excessive intake of curd, sweets, all these things can also cause ama production. So these things will produce ama. So ama can be at the Bhutagni level, Jatragni level and Dhatvagni level. Jatragni level usually as Artavaha Shrotas is very closely related to Rasavaha Shrotas. From the Rasa there can be Amarasa form which directly goes to Artava Poshana or Artavaha Shrotas. So there can be directly Rakta Dushti and Mamsa Dushti in Artavaha Shrotas, that is in Garbhashaya. So he has even enumerated Nava Udaka. So exactly what is now Nava Udaka is we cannot correlate to it. Majorly it is heavy in nature. Maybe they have given properties for different udakas. So exact correlation for this cannot be made. Nacha Deha Shuddhi. So Acharyas have always given for Swastha Rakshana, you always have to undergo Rutu Shodhana. If Rutu Shodhana is not there, every month our body will be going for wear and tear where the inflammation will be there. So if the timely toxins are not removed, there can be chronic inflammation. So that can trigger the formation of uterine fibroids or arbuda. So there can be even marma upagata. So affliction of the major we can see if it is Garbhashaya, you can take it as Garbhashaya marma, or you can take uterine artery injury, or there can be injury may not be physical. So because of the ama and because of the inflammation, anywhere the tissues can undergo affliction. And he has also enumerated one of the major nidana as Vishama Prasuti, this is seen in Gulma also. So where he says Vishama Prasuti can lead to, usually there is more Raktasava and then there will be Garbhashaya Shota can be there and then the Agnimandya will be there. So usually they have given 4 months as Paricharya should be given to combat her strength and to have Dhatu Pushti and Sharira Pushti. So if she is not following the proper things after Vishama Prasuti, there can be Vata vitiation which can again trigger the fibroid formation. Nitya Upachara, there are so many things. Usually we will be asking the patient to follow Ahara and Viharaja things, diet and regimen based upon the disease. So if they are not following a suitable Ahara Vihara, that can also be the reason for Shofa, Granthi and Arbuda. So next one is majorly, for my understanding, we can take Mamsaja Arbuda as uterine fibroid, where Shushruta says, Mushti Praharadibihi Aditaihi Ange Mamsam Pradushtam Prakaroti Shofam Pradushta Mamsasya Narasya Badam Etad A1 Mamsa Parayanasya. So here he has given mushti prahara can be taken as a physical injury, or we can even take recurrent and continuous tissue insult. So whenever there is a tissue insult in the form of, it can be a physical or it can be in the form of metabolic error, or even it can be inflammation, chronic inflammation which will be going on in the body. Mamsam pradushtam, that leads to, at the place of the tissue insult, there can be vitiation of the mamsa dhatu which leads to shofa. So there is inflammation and swelling which is there locally. Then pradushta mamsasya narasya badam. So that pradushta mamsa will be causing mamsaja arbuda. And he also says that it is very common in Mamsa Parayana, who takes meat as a main diet. So excess consumption of the meat is being given as a specific nidana for Mamsa Arbuda. So this is a better correlation where there is more excessive growth of the fibrous and muscular tissue in the myometrium. So which will lead to neoplasm and Mamsaja Arbuda. So how we can understand this samprapti? We have seen all the nidanas. So amarasa is a basic thing from the nidanas, where along with the ama there is even local inflammation and metabolic abnormality in the local tissues because of the vitiated doshas. So we know ama mannarasam kechittu malasanchayam pratama dosha dushtimcha kedachit prajakshate. This amarasa reaching to the artavaha stotas will be vitiating the rakta and mamsa in the myometrium, can cause mamsa dushti and can cause arbuda in the garbhashya, which can be taken as a mamsaja arbuda. So they have given a basic characteristic features of amarasa, that is shroto roda balabramsha gauravam manilam mudata, we all know. So this can happen anywhere in the body. It is not just in the amasya. It can be in the posta, it can be in any organ, it can be even in each cell. So shroto roda anila mudata, all these things can be taken as a local inflammatory process which will be leading to reactive hyperplasia in the local tissues, which in turn can lead to neoplasm. So I want to give more light on chronic inflammation, what mushti prahara and all these local tissue insult. So usually our immune system will be eliminating the foreign and abnormal antigens. So if you see, even the ovulation and menstrual cycle are inflammatory as well, but it will be a short time period and then the body will be acting on it and then the inflammation will be solved, and it is part and parcel of the life. But when the inflammation is chronic, even after healing, if it is not in a position to heal completely, because either maybe because of hormones, or it may be because of metabolic errors, or it may be because of abnormal diet and regimen, there will be continuous defective immune response leading to excessive production of cytokines like tumor necrosis factor alpha, interleukins beta. So all these things will be triggering the apoptosis. Apoptosis is a major life thing which is from our what we call intrauterine life. So therefore ovulation also it is needed. For limiting the endometrial growth it is needed. So if this apoptosis is not under check by the immune cells, there can be triggerants leading to immune response and then reactive hyperplasia. All these three are a bad combinations, that is metabolic errors, that is Agni Mandya leading to Agni Dushti, and local chronic inflammatory state which is majorly by the hormones and the byproducts, and then if there is no proper immune response or the immune response is not enough, leading to hyperimmune response. So hyperimmune response can also lead to reactive hyperplasia. So in turn it can lead to neoplasm. So as per my understanding, as Shushruta has quoted a word mam such as shofam kuroti mamsam arbudam. So as shofa and granthi can be considered when it is very smaller. Granthi, if it is 2 to 4 centimeters, we can consider it as a granthi. If it is growing beyond, because patients will be asymptomatic till it is 4 centimeters. So they will not be reaching out to the doctor. So most of the times it is what we call, it can be neglected. So when it becomes bigger along with the chronic inflammation, so these can be considered as a precursor or purva rupa of mamsaja arbuda in conditions like uterine fibroids. So this is one of the topic which I wanted. From the 2 decades, the fibroids are becoming more in incidence, and it is even affecting the younger age group. So there is a lot of research going on endocrine disrupting chemicals. There is difluorodiethylethane. There are some chemicals which are there. So these endocrine disrupting chemicals like PCBs, phthalates, and biphenol, all these are present in the air we breathe and soil where the cultivation happens and water we drink. So there are so many anti-aging chemicals, and even there are so many self-care products like shampoos, hairsprays, nail polish, cosmetics. All these through can even enter through the skin and food we ate. Like there are so many chemicals. At PCBs are usually there are made for. What we call containers, plastic containers, bottle caps, all these things, they usually will be passively entering the body. So these are, we are exposed to chemicals in day to day life. So these chemicals are already proven to reduce fertility. They're already proven to have a major role in PCOD and other cancers. So here also there is a lot of research going on their effect on fibroids, because these chemicals will change the body response. So they even mimic as estrogen, leading to abnormal steroidogenesis in the body. And it is proven that they reduce the sperm count in male and reduce fertility in female. But their exact relation, how they are acting on fibroids, is not yet known. So these mimicking estrogens are giving more reactive hyperplasia, which in turn may cause fibroids. So limiting the chemical exposure onto the plastic containers and what we call the artificial sweeteners and preservatives and plastic usage, hot containers, all those things should be avoided in order to avoid fibroids. As Pura Rupa is Avekta, these are the Samanya Lakshanas which are present. So coming to the Sadhya Sadhyata, Shushruta has given it as Asadhya. As uterine fibroids are recurrent and they are deep seated in the pelvic area in the initial region where it can be considered as Gambhira. So these uterine fibroids will be recurrent. Even after surgery, they will be coming. So even after treatment, if you have given treatment and then the patient again going for not following the diet, etc., can again lead to recurrence. So they cannot be completely cured by Shastra and Aushadha. So they are usually recurrent. So logically speaking, when Acharya has given, the treatment he has given is like Grantivat. Like Aushadha, Samshamana, Shastra, Kshara, they have given. So even after Shastra, Agni Karma, Kshara Karma, he has given that this is either Apya or Anupakrama when you take it as Asadhya. So they usually will be lifelong, will be present in the body without any kind of symptoms sometimes. And even after treatment, they will be recurring. So this can be taken as one of the Apya Roga, or sometimes when it is completely adhered and towards the bowel, bladder, very bigger. So it is deep seated with the deep roots, then it can be Anupakrama. Even if you try to treat, sometimes it can cause bowel injury, etc., even through the Shastra Karma. So it is very difficult to cure these when they go beyond certain limits with complications. So there are Visesa Lakshanas of all the types of fibroids, Vataja, Pittaja, Kapaja, Raktaja. Mamsaja, we already seen they are smooth, shiny, hard, painless, and usually have painless or slight pain. So when you take dosha, kapha is a major thing. Because of the kapha only, they will not undergo paka. So because of the cell division, so hyperplasia, hypertrophy, they are vata pradhana. And locally there is more of inflammation, which is majorly for the pitta. So all the three doshas are involved here. And doshas are Harita and Ashtanga Hridaya considers Meda along with Rasarakta Mamsa. So when there is Sangha, there is Granthi formation. They can even lead to complications like DUB or excessive menstruation, which can be taken as Atipruvati also. Mandagni will be there here. The Abhyantara Roga Marga can be taken. So Ama Pakvashaya, both are involved. Garbhashaya is the Vekta Sthana. So Pratyatma Lakshana is Mamsopachayantu Shofam. And there is a beautiful concept which usually can be very much nearly correlated to uterine fibroids, which is Adyarbudha and Virarbudha. Ejjayate anyat kalu purvajate jnayam tad Adyarbudam Arbudha gnaihi. So whenever there is second Arbudha which is developing over an existing one or beside it is called as Abdyarbudha, which is commonly seen in uterine fibroids. First there will be one or two, then if it is not treated, patients will be coming with the 2 year scan. First it will be one, after 2 years they will be coming with multiple fibroids. So that can be considered as Adyarbudha. because of the recurrence. Second one with dvandva jatam yugapat kramatva dvirarbudam tacha bhavet asatyam. So there can be simultaneous presentations after one over the other when one goes bigger and the second one can be too much bigger, which is called as Veerarbuda. Usually the Shalyatantra people take this as majorly as metastatic condition. So here also it is to some extent it can be correlated because they are simultaneously presence of the fibroids which grows bigger. So coming to the treatment aspects, Granthi treatment should be given like Shamana, Shodhana, Shastrakarma, Kshara and Agnikarma. Because these are Mamsa Pradoshaja Vadis where Shastrakarma and Kshara plays a major role for treatment aspect. Shodhana, we usually do Deepana Pachana before any kind of Shodhana. So Trikata Churna, Dadimastaka Churna, Hingvastaka Churna, Panchamrita Kashayam are usually given. For Snehapana, Gugulu Tiktaka Grita, Varunadi Grita, Indukanta Grita, Kashmiriyadi Grita is also given in cases of menorrhagia along with fibroids. Svedana Nadi Sveda, Patrapinda Sveda can be given. We usually focus to remove the chronic inflammation for Vata Pitta Haranaptam and Kapha Lekhana. We usually give Lekhana Basti and Virechana. Uttara Basti, usually we go for Kshara Taila, Lashunadi Taila, Kasisadi Taila, and MD4 Taila is giving very good results in current scenarios. So there are different churnas and kalkas. So all these can be avasthanusara. So if a patient is coming, the patient may be coming to you with DUB. The patient may be presenting with the complaints of menorrhagia, and some patients may be coming only with the pelvic pain. So when there is a pelvic pain, usually we go for this one, Gandharva Hastyadi Kashaya to relieve the pain. We will be even giving the bastis like Sacharadi Taila Basti and Vastiyamayantaka Grita Bastis we will be giving in order to relieve the pressure symptoms. If there is bleeding, we will be doing Rakta Shodhana and Rakta Stapana Chikitsas. Usually it may be with Ashoka Rishta and Ashoka Grita, or even it can be Musali Kadiradi Kashaya, Chirabilvadi Kashaya, Saptasaram Kashaya. So it depends. The treatment is always tailor-made. It cannot be like the same. If you have fibroid, please take Kanchanara Gugulu, Chandraprabhavati. It cannot be done. So patients will be having a different kinds or varies presentation depending on the site and location as already discussed. So whenever a patient comes to you with menorrhagia, the treatment is completely different, which is Rakta Stapana and Rakta Shodhana. Okay, so where you have to do majorly, first patient coming to you itself, they will not say fibroid, they say prolonged bleeding from 1 month. So you have to do Rakta Stapana, then stabilize, reduce the inflammation, and then go for Panchakarmas like Virechana, Basti and Uttarbasti. Whereas if the patient is coming for fertility, then you have to directly go for Virechana, Lekhana, or even surgery can be prescribed when they want fertility. Okay, if any perimenopausal woman or postmenopausal woman comes with 3 or 4 centimeters, that can be managed with the basic medications and rasayana with basic diet restrictions where they will be managed throughout the life. Okay, so it is always tailor-made. You cannot give same treatment for every patient. That is one of the important point I wanted to highlight. So when there is Kalyanaka Kshara is the best Kshara which is given in Mamsa Pradoshaja Vikaras. 500 mg BD is given, and the symptoms have completely reduced in patients who are not having bleeding. So when patient comes to you only with the fibroid without any symptoms, you can directly go for Lekhana Ksharas or oral Kashayas to reduce the fibroid. If they are coming with symptomatology, then your treatment will be changing with the first setting, second setting, third setting you have to plan. So in tablets, you can go for Chandraprabhavati, Kaishora Gugulu, Kanchanara Gugulu, Shikru Gugulu. They are having Lekhana. Shilajatu is also Lekhana Rasayana property. And Kanchanara is Shotahara and it is Lekhana, and also it heals and reduces the inflammation. And Kashaya, as Gugulu Tiktaka Kashaya has given wonderful results in all inflammatory menorrhagia because of the fibroids. Kanashatavadi to improve the Agni, and Chirabilva Varunadi to reduce the size. Abhyarishta, Ashoka is we know saponins, and there are beta cytosterol and other things. It does Rakta Shodhana, Rakta Stambhana also. So Abhyarishta helps in easy evacuation of the bowel, and also it is Rakta Stapana, Prajastapana. So Avalehas, there are different gritas like Vastiyamayantaka Grita, Varanadi Grita, Gugulu Tiktaka Grita, Krita. Kashmir Yadi Krita we have prepared in our pharmacy. It is giving really wonderful results in all menorrhagia related to fibroids and also in other DVP cases. Shodhana helps to remove the ama, and here usually the Snehapana things, whatever I have mentioned, will be given to the patient. There does Kafahara, Medohara, and Vatanalomana action. And Kalyanakakshara is Arbudahara and Arshashara. So it is also mentioned as one of the major drugs which is usually given for the patients. So I wanted to highlight what exactly we do with Uttaravasti. Post cycles we usually call the patients for Uttaravasti. So MD for Thaila is a base of Tilathaila, which where there is Mungitaka, which is given in the classics. It will do the angiogenesis. So usually fibroids will be having a peripheral circulation. So if there is angiogenesis, if you Vevai Vikasi guna of your drug can reach and then can stop the blood supply, usually there is shrinkage or there can be even degeneration of the fibroid tissue, cystic degeneration. 8 centimeters fibroid have come to 4 centimeters and 3 centimeters, but it will not completely become zero. It cannot become zero. There can be cystic degeneration. There is completely the symptoms can be stopped, or symptomatic treatment can be 100% be successful. And local, we have got a folklore practice of Ravi care. Previously, this drug was used very successfully in all fibroadenoma of the breast of young women. So it has given very good results. It is made up of ragi, which is banyan trees. So there are some other drugs. It is a folklore medicine which is not in pharmacy everywhere. It is not available, but it is available in Bangalore. My teacher, Dr. Ramesh, has practiced this in fibroadenoma, and even I have got good results. This can be applied in the lower abdomen. So usually there is an epidermal or dermal transport of the drug. So there is absorption through transdermal absorption of the drug is also one of the study. So where the drug can be absorbed. So the Ruksha Gunas and Katu Vipaka hot potency can also help in drug absorption, can lead to reduction in the symptoms and size in long run. So Saindavadi Thaila local Abhyanga or Pichu, the dressing tampon can be dipped in oil and then can be kept over the abdomen to reduce the pain. So these MD4 Thaila for the patients who are having joint pains and all, they cannot be taking Uttaravasti in some Panchakarma where they will be referring us. So when Uttaravasti is not possible, even Yoni Pichu has given good results. So Uttaravasti, as Acharya says, the near root you have to expel the dosha. So for the uterine fibroids, so Garbhasya is the nearest route to expel the dosha. So we will be giving Uttaravasti. So with all the drugs, whatever is mentioned, Kasi Sadi Thaila, which is successful in cervical erosion and cervical polyps and other conditions, is also useful here in uterine fibroids. And MD4 Thaila is also very good, and we have even used Gulu Tiktaka Grita, ST Madhukati Grita, which are giving good results in reducing the symptoms. So when you cannot use Kshara Thaila, previously I was using more of Kshara Thaila in uterine fibroids, but it cannot be given in menorrhagia where there is a lot of inflammation, and you cannot give it in PID cases and when there is Arthavakshaya. So only when fibroid is in the myometrium without any symptoms, then only you can go for Kshara Thaila. So we will be putting on a patient for a particular diet in order that there will be immediately a regression of the symptoms. So for explaining this diet chart, it takes very long time. Usually we will be giving green gram, horse gram as cereals, green leafy vegetables like fenugreek. And there are other things like ajwain water and hing and moong dal khichdi, which we will be doing a recipe and then giving them this diet chart. Strictly following the diet chart has really improved the quality of life. These are the Patya according to Yoga Ratnakara. And Yogasanas will strengthen the Kshetra, that is, it will relieve the Vatana Lomana and strengthen the pelvic organs and improve the circulation. So they are also benefiting along with the medications and treatment. Coming to the case study, I wanted to discuss few cases. So there are so many patients who will be coming to the OPD, and we have successfully treated in 90% of the patients. There will be reduction of the symptoms. Sometimes we will be going for surgery. Some patients will be having successful remission of the fibroids. So we will not be keeping the data for the data to collect. Sucheta ma'am has asked, everywhere you have to be keep ready the data, which is, so from now onwards I will be trying to, in 2-3 days we have gone to MRD and collected few case sheets for fibroids. So there was 42 years female who has come to my OPD with prolonged bleeding from 1 month. So she is suffering with this from 8 years. The fibroid was 4 centimeter into 3 centimeters. So she was given, initially she was given with Ashoka Grita to stop the bleeding, and Panchvalkala Kvata abdominal packing was done along with the Stiflon tablet, and she was very much anemic. So Orofer injection was given. In 3 days, the bleeding has stopped. And then we have given her Kashmaryadi Grita Uttarabasti. Immediately after stopping of the periods, we have done USG, and then in the next cycle itself, her cycles became, she was having cycles every 15 days once, and she used to change 6 to 7 pads per day, which is mentioned here. Later, her cycles became regular on the follow-up. She has come in July 23rd. So her cycles have become very much regular. When she came, first visit was in the April. So later, immediately after 1 month of one course of Uttarvasti only, there is complete remission where she was suffering from 8 years. So the quality of life can be immediately improved, even though Ayurveda, through Ayurveda, because modern have lot of side effects. So that attracts the patients for Ayurveda. When they come to us, we have to give them immediate results so that there will be more chances of research, and then we can do a better research and documentation on this. So immediately in a 1 month, there were regular cycles, and she was given Gugulu Tiktaka Kashaya GP 500 capsules, and then she was asked to come next month. These are her reports. Previously, she neglected, when in 2021, the fibroid was only 2 centimeters at the fundal region. Later, she neglected, she did not take any treatment. She used to take only pause enough. Later, when she did scan, when she coming to me, she has come in April, where her uterus was with multiple fibroids. So with severe bleeding and anemia requiring blood transfusion, but however, we managed with all our medications. A 31-year-old female wanted to conceive. So if you see here, she had come to me on March 24 with infertility. She wanted to conceive. She was IVF failure patient, and we wanted to plan Virechana and Basti for her. So the inflammation was reduced with Virechana and Basti, and she conceived next. So this was a successful case even with the fibroid. Now she is 6 months of amenorrhea. She is continuing successfully with all the Ayurveda ANC, and she is very happy patient. And there is one more case study where a patient of 21 years old has come. We have given her Trayantyadi Kashaya, Trayodashanga Gugulu Ashoka Rishta. The fibroid which was there, which was very negligible, has disappeared in 1 month of medications. So when it is small, we found that they will immediately disappear. If it is more than 4 centimeters, then only it causes problem or reduction. It takes longer time. There's one more patient who is 46 years old female. She has come to me with excessive bleeding. She will be having cycles every 15 days once. On examination, we have seen her, there was a submucosal fibroid extending into the cervix, 3 into 3 centimeters. And there was around 6 centimeters fibroid which was there. She was also having menorrhagia and pain abdomen symptoms. And she has come to me. First, we have done hysteroscopic polypectomy was done. So I have, on examination, there was 3 into 3 centimeter cervical polyp. So after the removal, for intramural fibroid, we have planned for Yoga Basti. So first she has given Gugulu Tiktaka Kashaya GP 500 post polypectomy. Then you can see the fibroid size here, where it was 6 into 5 centimeters, the bleeding. Then her cycles became regular. She visited me after 2-3 months in May. So her cycles have become regular, and polypectomy was done, and she was given Kalyanaka Kshara and Uttarabasti with MD4 thyla. So this has given good results. We are awaiting her scan report. There one more patient of 33 years old with irregular cycles since 6 years. There are 6 into 6 centimeters. She is undergoing Lekhana Basti. So coming to the discussion. So uterine fibroids are the most common benign growth of female reproductive tract, causing menorrhagia, dysmenorrhea, low backache. Oral medications in the contemporary science have side effects, so majorly there is surgical intervention. So they come for Ayurveda. So we can treat on the basis of Granthi Arbuda lines of treatment. So yes, so Arbuda Granthi can is mentioned as Mamsadhatu Vruddhi Dushti Lakshanas. So we will have to do Shotoroda and Atipravrutti Sira Granthi has to be managed through Ayurveda treatment like Shofahara treatment. So roughly, uterine fibroid can be considered as Mamsaja Arbuda. So which is most surgical intervention nowadays. Even 2 centimeters fibroid, modern gynecologists will advise them for hysterectomy. So Ayurveda medicines can perform much better in conservative management of the disease, cause without much complications compared to the modern medicines. So this has to be explored more in research so that we can prove much feasible and non-surgical method of fibroid in improving the quality of life of the female. Thank you.
Thank you very much, ma'am, for such a profound and thought-provoking section. Now, we will open the floor for questions from our participants. This is an excellent opportunity to gain deeper insights and clarity on the topics we explored today. You may kindly post your queries in the chat box, and Dr. Sharmishta, third year PG, will read up the questions.
Ma'am, there is a one question. Mode of action of Kashmariyadi Ghrita in uterine fibroid.
As already told, Avasthanusara Chikitsa has to be done. Kashmaryadi Grita will reduce the inflammation. So Kashmaryadi Grita cannot be given directly in fibroid. Kashmaryadi Grita is given when there is a symptomatic fibroid where the patient will be presenting with menorrhagia kind of symptoms with chronic inflammation which is leading to excessive bleeding in the woman. So when there is excessive bleeding, we usually either orally give Kashmiri Adigrita or we will be doing Uttarabasti in order to reduce the inflammation. And it is Pittahara and Kashmiri Gambari, it is having different kinds of drugs in reducing the inflammation and it is a major drug of choice in Asrigdara. Okay, so even in submucosal inflammation also it will be reducing, but it is not used to reduce the size of the fibroid.
Thank you, ma'am. Next question is Tailas used for Uttarabasti and Pichu.
Previously, we were using Lashunadi Taila and Kshara Tailas and Kasisadi Taila. Now we have got one MD4 Taila. As already I have shown, Tila Taila based, it is having Munditaka as a main drug. So this is the main drug which is used when there is no inflammation to reduce the size of the fibroid. MD4 Taila can be used. Kasisadi Taila, Lashunadi Taila can be used. When there is more bleeding, you can go for Guguru Tiktaka Kashaya, ST Madhukadi Taila, or even you can go for Mahanarayana Taila.
Thank you, ma'am. Can you throw some light on the ingredients of MD4 Taila, ma'am?
Yeah, I will. I have a slide. I will show you.
Hello, ma'am.
Hello.
Yes, ma'am.
There was a connection problem. Am I audible now?
Yes, ma'am, you are audible. Ma'am, next question is
asking for
how
MD4
GP
taila. Actually, the main ingredients are dhanyaka, munditaka, and tilataila base.
Okay, ma'am. Thank you, ma'am. Next question is how GP500 works in fibroids.
That is again for inflammation, as we were discussing for cases. Whenever the patient comes, we cannot actually stick to the anti-fibroid or fibroid reduction treatment only. GP500 is one of the Gandhaka Rasayana. Major ingredient is Gandhaka Rasayana. It is Pittahara and it immediately reduces the chronic inflammation. In turn, long run, it can also help along with the Gugulu preparation. Either it can be Trayodashanga Gugulu or it can be Kanchanara Gugulu. Gugulu combination with Gandhaka Rasayana has given good reduction of size of the fibroid in long run.
Thank you, ma'am. Next question is management of bleeding by Ayurveda. It is a case of posterior multiple uterine fibroids, size of 4 centimeter into 3 centimeter into 5 centimeter, along with anemia, ma'am. How to treat the menorrhagia in Ayurveda?
Posterior, if it is submucosal, obviously it will increase always. If it is less than 0.5 centimeters, it is better to, you can treat with Ksharatailas and other things. If there is more bleeding in the posterior wall, if it is in the anterior or posterior wall, menorrhagia has to be strictly controlled on the size 4, 3, 5 centimeters can be done with Virechana, Lekhana Basti and Utravasti. Virechana, depending upon the Prakriti, you can select Indukanta Grita or Gugulu Tiktaka Grita or Varunadi Grita. Or Lekhana Basti, we usually go for Gomutra Arka. So Gomutra Arka Basti along with the Kalkas of Lajjalu and Musta, Yashti, Guduchi, which are anti-inflammatory and immunoprotective in nature, can be used for Kalka. Dhanvantaram Kujambu can be used for Taila, Sneha, and Mahanarayana Taila can also be used. Anuvasana, we can go for Sahacharadi Taila or Lodradi Astapana Bastis or Anuvasana Bastis can be given. Along with that, MD4 Taila can be given for Uttara Basti. These cases can be easily managed where the size is 3, 4 and 5 centimeters. So it takes minimum 3 to 6 months. The patient, you have to take the confidence of the patient and then post her for Panchakarma diet and the Shamanaushadhas. Shamanaushadhas are also very, very important.
Thank you, ma'am. Next question is how should we approach cases where patient experience heavy bleeding during their cycles, feel anxious or scared? What should be our role in counseling the patient in such situations?
So every part of this is discussed when the woman is having fibroids. So it depends upon the size and localization. You have to be very sure whether the bleeding is because of the fibroid or it is because of endometrial hyperplasia or any other causes. So if the cause is fibroid, you have to reduce the inflammation and you have to give stambaka, Rakta Shodaka, Rakta Stambaka drugs. Asradhara line of treatment, Rakta Pittahara line of treatment has to be given. So counseling is obviously when they are using minimum. So many patients will be using menstrual cups, which is completely contraindicated in excessive bleeding. You have to educate in every level, not taking bakery items, microwave food, and fast foods which carry a lot of chemicals and they don't have any micronutrients. So spices has to be cut down and counseling has to be done. So when usually there will be anemia, if there is a prolonged bleeding, you have to correct the anemia. Counseling has to be given that this is easily curable and you have to give it time. So counseling, if there is more anxious, you can put her on some yogasanas and pranayama and mudras, which will help in relaxing the body. Because anxiousness can also lead to more bleeding. So because of the pelvic congestion, there can even be bleeding. So other things, whatever the medical management is there, that has to be managed with the same, based on Ashribdhara line of treatment only. And you have to rule out, based on the age, we will be ruling out causes, whether it is a PID or endometrial hyperplasia or it is endometriosis, because even endometriosis adenomyosis can also be there in elderly females. So you have to do a proper diagnosis and then you have to treat the patient.
Thank you, ma'am. Next question is, in pregnant women with uterine fibroid, if the patient is having pain, what is the line of treatment in Ayurveda?
So usually we will be going for Garbhachalana Chikitsa, Lodra Pipali Rasayana, where Mamta madam was used to give. So that you can give. Usually we will be giving paracetamols. So immediately they will NSAIDs. They will immediately reduce the inflammation. And however, the local application of Ushira Manjishta can also be given. So there is less chances that there is too much of degeneration unless it is subserosal. There won't be any too many complications. So if the torsion is there, you may have to go for surgery. If it is less than 6 centimeters, 7 centimeters, a basic local application and oral samshamani vati or guduchi sattva can be given in order to reduce the symptoms.
Thank you, ma'am. What are the surgical indications for a fibroid in relation to their size and symptoms?
Surgical relation?
Surgical indications for a fibroid in relation to their
fibroid, the surgical indication is not there. When the female want to have conception, if it is submucosal fibroid, because it will be having an inflammatory effect and can disrupt the implantation, so miscarriages will also be there. If there is submucosal fibroid, it has to be removed. If it is more than 1 centimeters, it has to be removed. If it is submural and intramural, if it is more than 5 centimeters, it has to be removed. Subserosal, there is no need to remove. You just have to do Shodhana and give Garbhastapaka Dravyas. That is enough for them to continue their pregnancy. There are many women with subserosal fibroids will continue their pregnancy. There is no need of any surgical intervention.
Thank you, ma'am. Next question is, does administrating the stambana in the management of excessive bleeding have any risk of disturbing vata dosha, potentially leading to the further complications?
Yes. We have seen many patients previously in the early years of our practice. We used to give Panchavalkala Kvata 30 ml 4th hourly. So patient has become very restless because it is having Ruksha Guna and Stambana property. There can be hypotension also, there can be restlessness also, that we have learned in early stages. So never give too many kashayas to reduce the bleeding, to stop it immediately, or aggressive treatment should never be given, because already there is vata prakopa. If you are giving kashaya dravyas, that too in a vata prakriti female, there can be side effects like restlessness, and there will be what we call hypoxic conditions also, where the BP will become low. So you have to measure the pros and cons and then give accordingly.
Thank you, ma'am. Ma'am, next question is, as you mentioned, Ati Mamsa Sevan can cause Arbuda. For the patients who are Mamsa Rasa Satmya, how to plan the Chikitsa?
So they have given one of the Nidana as Mamsa Rasa. So Mamsa, they have given majorly as red meat. Okay, so red meat, we have many categories of the meat. So lean meat is there, white meat is there. So you can ask the patient to go for salmon or any other kind of lean meat fish. And processing is very important. Ayurveda always says bhavana and how you make the dravya is very important. Instead of going for kebabs and biryanis, they can make mamsarasa as a light, or they can reduce the intake, so that mamsarasa is again agni deepaka. This is also contradictory. It is not like ati mamsa sevana, they can cause fibroids, but it is not that you can completely stop them to eat. You can give in other choices, and then the samskaras can be changed so that they can help in increasing the jatragni and datvagni, not adding to the samprapti. That can also be planned, because we have many good diets and protocols, and also even recipes to give for mamsarasa sadhana people.
Thank you, ma'am.
Thank you so much, ma'am. I now invite Dr. Sucheta Kumari, Head of Department of Prasudi Tantra and Stri Roga, SDM Udupi, to offer her thoughts on today's session.
Congratulations, Padma Sarita.
Thank you so much for the opportunity, ma'am. Thank you so much.
So, it was a very good presentation with the full explanation, starting from etiology of the fibroids till the research updates, and also Ayurvedic perspective. And the most important thing is the case studies which you have presented, all different types of cases. So you told me, when I told you to present the cases, you told me you didn't have enough data. So please keep the data ready of the important cases, which are the successful cases. Okay. So once again, I thank you for the wonderful presentation, and also
Because 3 days time kottidira ma'am, you have given me 3 days, so I could collect few cases. From now on, the lesson is to collect more data and then keep it ready.
Yes, actually, time was very little, I can understand. But in this very short span, you have done a good presentation. And also, I knew that you were very busy with other activities. Okay, anyway, it was a very good presentation. Next is in webinars and seminars, usually response of the audience is very much important. So the response which we got for today's seminar was overwhelming, and we could not actually accommodate everybody in the Google Meet. So we had to create one YouTube link also. Once again, I thank the audience also. So I am happy to announce that we are having future plans of conducting short-term courses and webinars, etc. And our next short-term course is on the infertility. So audience, please be in touch with us. Okay. Once again, I congratulate Padma Sarita, and also I thank the audience. Thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you so much, ma'am. To formally conclude the session, I now invite Dr. Neha, second year PG scholar, Department of Prasudi Tantra and Sri Roga, to deliver the vote of thanks.
Good afternoon, everybody. On behalf of institution and organizing committee, myself, Dr. Neha, second year PG scholar from Department of Prasudi Tantra Evam Sri Roga, is here to deliver the oath of thanks. It's my immense pleasure to thank Dr. Padma Sarita K. Ma'am for the wonderful and informative session on Ayurvedic perspective of uterine fibroids and its management. Your talk helped us understand complex topics in a very clear and practical way. You showed us Ayurvedic perspective of uterine fibroids and its management in best way possible. Not just mere theory, but something that plays big role in real patient care from diagnosis till treatment and even prevention. The The example you gave and the way you explained each point made it easy for us to connect the science with clinical practice. We truly appreciate your valuable time and effort you took, ma'am, for us to share your knowledge. Thank you, ma'am. I thank our beloved principal, Mamata KV ma'am, for providing us with this opportunity to conducting such a informative such sessions, and we are also looking forward for your motivation and guidance in future to conduct such sessions, ma'am. Thank you, ma'am. I thank our head of department, Sujata ma'am, for organizing the program and guiding us in making this webinar eventful. Thank you, ma'am. I extend the gratitude for all faculties of our department for their guidance and constant support in each and every step and making this event successful one. I also thank all our participants who have participated in this webinar for their valuable presence. Last but not the least, I thank our PG scholars, technical support staff, all teaching and non-teaching staffs, and everyone for being the part of this national webinar and making this a successful.